Let's start the test. This is a recording for occupational English test held in Ajinorah institutions, Kochi. The candidate is Liz Maria Shaji and the candidate number is 2000246656. The interviewer is Vibin Wilson and the interlocutor's number is 641382. The role play numbers are 1 and 2 and the profession is nursing. Good afternoon, my name is Vibin Wilson. Can you say your name for the record purpose?
Good afternoon, sir. My name is Liz Maria Shaji.
Cool. And what is your candidate number?
Yes, my candidate number is 2000246656.
Thank you. And you are taking this test as a nurse, is that correct?
Yes, I am.
Cool. Can I see your ID, please?
Yes, here it is.
Thank you. Here you are.
Thank you, sir.
So please confirm your details on the test paper, then read and sign the declaration in this booklet.
Yes.
Here is your pen.
Thank you.
Thank you. So I am going to be working with you for this test. There will be warm-up questions followed by a role play.
Yes.
Remember, this is a test of English, not of your professional knowledge.
Okay.
And please speak naturally. Do you have any questions?
No.
Cool. The warm-up questions are not assessed, but it is a chance for us to get used to each other's voice. We will just talk for 2 to 3 minutes.
Yes.
Is that fine?
Yeah, that is fine.
Cool. So your first question can be, what are the qualities as a nurse you are expected to possess?
Well, in my opinion, there are so many qualities that is required for a nurse. But for me, I think it's about communication skill, keen observation, and be empathetic to the patient.
Okay, that sounds great. Thank you. And do you think nurse should attend continuous nursing education?
Yes, I do. Because by attending the continuing education, they could update their knowledge and they could implement that knowledge into providing the quality care to their patients.
Okay, that sounds great. So there we come to the conclusion of your warm-up session.
Okay.
Let's move on to the role play now. I will take the part of the patient or perhaps a relative, and you will take your professional role.
Yes.
The role play will last for 5 minutes. The purpose of the role play is to get evidence of your ability to communicate effectively with the patient. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, sir.
Cool. You have up to 3 minutes to prepare the role play.
Okay.
You will start the role play after that time. I will let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want.
Yeah, okay, sir.
Here is your pen and
you.
here is your role play card.
Yes.
All set?
Yes.
And your 3 minutes starts now. Your 3 minutes are up. You can look at the card during the test, but you must return to me at the end of the test. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up.
Okay.
Can you start the role play, please?
Good afternoon.
Very good afternoon to you.
My name is Liz Maria Shaji. I'm one of the registered nurses working in this emergency department.
Okay.
For the documentation purpose, would you mind telling your name and age, please?
My name is Vibin Wilson and I'm 33.
Okay, Mr. Vivin, glad to see you.
Yeah.
You seem a little agitated.
Yep.
Can you explain me what is the reason behind that?
Sure, I can explain to you. I'm waiting here for past 30 minutes
Okay.
and no one turned up to me. What's the reason behind?
I am truly apologizing for that. You know, this is an emergency department and we were dealing with a critical situation patient, and the doctors and nurses were engaged in that. That is why there was a delay. Okay. I hope you can understand that, Mr. Vibin.
Yep, I do understand.
Okay, that is fine. Thank you for cooperating with us. Okay, Mr. Vibin, may I know what is troubling with you?
The reason behind I made a visit over here is that I have some symptoms like nausea, tightness on my chest and dizziness. So I thought I'll consult with a doctor.
Yeah, you can consult with the doctor. I will be arranging that. But before that,
Okay.
can you please explain to me how this symptoms has been happened, like
Okay.
its onset and frequency?
It is like these symptoms started a month ago, and soon after the death of one of my friend.
Okay.
And it is like these symptoms come and go, but they get worse with each episode.
Okay, I'm so sorry to hear the loss of your friend,
Okay.
but we can manage that. Your symptoms can be manageable. It is manageable. Okay. So before that, I would like to know whether have you taken any kind of medications? Have you seen any kind of doctor for this?
I consulted with a doctor and he prescribed anti-depressant tablets to me last month.
Okay.
But I am not regular with taking these tablets because these symptoms are not so regular with me.
Okay. So that is the reason why you are not taking these medications regularly.
Exactly.
Okay. But look, Mr. Vipin, can I explain to you about the need of this antidepressants which needs to be taken regularly?
Please go on.
Okay. This antidepressants that you were taking, that is, which were prescribed by the doctor, is really important for your condition.
Okay.
Because this antidepressants is needed to be taken in at least 4 weeks. Okay, it should be taken at least continuously for 4 weeks, because only then it will help you with relieving your symptoms.
Okay.
Are you getting my point, Mr. Vibin?
Okay, I do understand.
Okay. So, are you willing to take the medications
Since
from
you
now
are,
on?
Okay, since you are urging me to take it, now on I will be taking.
Yeah, I appreciate for your willingness, Mr. Vibin.
Okay.
Is there anything that you need clarifications?
It is like, what is the very next best step I can take?
Yeah, the next step is you will be seeing the doctor and he will be consulting with you.
Okay.
But before that, as a nurse, there are some procedures prior to meeting the doctor, and I'll be taking your vital signs.
Okay.
Do you have any idea what these vital signs are?
I don't know. Can you elaborate upon?
Yeah, that would be fine. This vital signs is checking your, it's a normal medical checkup, like checking your BP, pulse, temperature, etc.
Okay.
And I think you don't mind me taking it for you.
I don't mind. Please go
Okay,
on.
Mr. Vipin, thank you for cooperating with me. I'll be here within 5 minutes. In between, if you are having any kind of problems, please feel free to say that.
Okay.
And I'll be telling the doctor to see you within 10 minutes. I hope you can manage the time.
Sure, I
Okay.
can.
So, is there anything that is troubling with you?
At present, there is nothing. If there is something, I'll let you know.
Yeah, glad to know that, Mr. Vipin. Okay then, thank you.